Well, we're learning that Bob Saget's death last month stemmed from an accidental blow to the head. Authorities say he died of head trauma caused by hitting his head on something and not thinking much of it, and then he went to sleep.
As you know, the comedian and Full House star was found dead in a Florida hotel room on January the 9th, and he had performed in the area the night before as part of a stand-up tour.
All right, joining us now to discuss these developments is internist with Northwell Health, Dr. Frank Contessessa. We call him Dr. Frank. Great to have you with us, Dr. Frank.
Thanks for having me back. How you guys doing today?
Doing well. So no drugs or alcohol in Bob Saget's system. He did hit his head and probably had a concussion before he went to bed. And, you know, if you ever have had severe head trauma or known anyone who's had a concussion, the doctor always says you got to be careful when you go to sleep. Could this death have been prevented if Bob Saget had taken this seriously, got the medical attention he had needed?
Potentially, yes. You know, it's hard for me to say specifically because I certainly don't know the circumstances of how he hit his head or what exactly happened. But potentially, yes. What you really want to look for in these cases, and what probably happened, was something called a subdural hematoma, which is the most common brain bleed that you typically see after trauma. Car accidents, falls, hitting your head, that sort of a thing, sports injuries. What can happen is the little veins that drain the surface of the brain, there's little layers between the surface of the brain and sort of like a saran wrap layer that goes over it, and blood can collect if these little blood vessels rupture and can cause pressure on the brain. Usually what you're going to tend to see is the same kind of symptoms that we look for with stroke. So you would look for progressively worsening headache, weakness in a limb, the face, slurred speech, change in behavior. If all of a sudden a person is very lethargic or is acting differently, their personality changes, blurred vision, double vision, the same kind of things that we typically associate with a stroke. Usually these are going to happen within about 72 hours. That's usually the danger window here. So if you're past that, chances are you're going to be okay. If you're within that and any of these develop, you get in for immediate help.
And in this case, unfortunately, he was alone in that hotel room, so I guess we'll just never know, Dr. Frank. But we want to talk about another comedian who made some headlines this week. Heather McDonald was on stage. She's doing a set when she faints and she collapsed. Now, it was such a bad fall. She had a skull fracture and was admitted to a local hospital. We're happy to report today she's out, she's recovering. She's 51 years old, and I think the twist on this is right before she fell, she was talking about how she was vaccinated, boosted, never got COVID. She said she was bragging about it. That's her words, not ours. But then some drew, you know, a little bit of a sidebar here saying, could her vaccination have caused some side effects? Dr. Frank, how do you answer those who are kind of drawing a line between those, because she is apparently a healthy person?
Sure. You know, I saw the video myself, and I thought that the fall was part of the act also because she had just made a joke and a reference, and the audience was laughing. They thought it was all part of the act. Could it have been from a vaccine? It's possible. You know, there's no way to say for sure, but what I can tell you is that we have seen unusual things happen after a booster or after an initial vaccine course. I've seen blood clots. I've seen strange rashes. I've seen menstrual irregularities, really unusual things. It's hard to definitively link to the vaccine, but is it possible? Sure. I did watch the video, and what it looks like to me could have happened is something called a vasovagal syncope. Vasovagal is a sudden drop in blood pressure, and it could be, this is typically in the movies when somebody faints after, you know, getting a scare or, you know, bad news and they faint. That's typically a vasovagal syncope, or if they get blood drawn, if they see a needle, see blood, they pass out. Sudden drop in blood pressure takes blood away from the brain. You get dizzy, you can pass out and fall. So that looks like it is possibly what could have happened. She also could have had a seizure, but she hit her head pretty hard and she had a skull fracture. So I'm sure we're watching out for these kind of brain bleeds that happened to Bob Saget. I'm glad this one had a better outcome.
Yes, as are we.
All right, Dr. Frank, thank you. Great to see you.